We are counting down to Breast Cancer Awareness Month, and we're talking with doctors who are helping survivors feel like themselves again. Dr. Daniel Yoho is joining us from Crystal Clinic Plastic Surgeons, one of the many miracle workers. I've seen so many patients who have come through your facility there and have had their lives changed because of it. Thank you for being here this morning.
Oh, it's my pleasure. Thank you, Natalie.
You know, there are so many options for reconstruction for women after they've been diagnosed, one of them being implant-based. What are the advantages of maybe going to an implant-based surgery for reconstruction?
Well, Natalie, implants are the most common way that we rebuild the breast after cancer. For a woman who's considering a mastectomy, implants provide an option for immediate reconstruction, which we strive to do whenever possible because it's been shown to have long-lasting emotional benefits, which are especially useful during a difficult cancer journey. For the woman who's planning to have a mastectomy, implants offer a certain degree of simplicity. It allows them to have that operation concurrently with their mastectomy in most cases. But for women who have had, say, a mastectomy in the past and elected to forego reconstruction at that time, we have adjustable implants called tissue expanders that can be placed in order to stretch the skin and allow them to be reconstructed at a later date.
And personally, I went through that with tissue expanders first before the implants. And I understand what you're saying, that it can be more of a mental game with patients than it is even physical. But when you're looking at who would be a good candidate for the implants, who would you say is the best for that?
Well, fortunately, as more and more women are understanding the importance of mammography, early detection is becoming commonplace. The average woman walking into my office is in good overall health and has adequate skin to be a candidate for immediate reconstruction. And whenever possible, I strive to do that for the emotional benefits. In general, patients who are planning a reconstruction concurrently with their mastectomy, my top priority is always high quality cancer care. If radiation or chemotherapy is anticipated, implants can provide a temporary reconstruction that can allow them to begin those treatments without delay.
And I'm sure because you've seen it firsthand, I mean, the process and what it's like for a woman to go through this, I think it's more fearful for them in the beginning of things than as they're going through, because the process of getting the mastectomy, but having that implant put in almost immediately in a lot of cases really eliminates the whole, the psychological aspect of what women go through that process.
Yeah, it's really heartwarming to watch a woman wake up the day after her surgery and look at herself and realize that a lot of those concerns that she may have had didn't manifest into reality. And seeing that smile on their face when I walk in that morning after surgery and the confidence they feel in their body through that process is really heartwarming.
And they can, as far as the surgeries go, if you're doing an implant reconstruction, how often would they then maybe have to get it done again to just maintain what they have?
Well, thank you for bringing that up. It's important that women understand that implants are not lifelong devices, that we usually will recommend replacement of those implants every 10 to 15 years as part of routine maintenance of the reconstruction, and the goal there being to avoid the risk of the implant rupturing.
Well, and I think it's always so important if you're a woman going through any of this right now to talk with a doctor about it, because maybe you've already had implants and you might want to go a different route the next time around with a deep flap or some other kind of surgery. There are so many options available, not just for that first surgery for women.
Yeah, and that's why I'm a big advocate of doing your homework, understanding what your options are, and then making sure that you get at least a second or potentially a third opinion, and that women have that opportunity to gain perspective on their reconstructive options, hear different opinions on what may be best for them, and I think that that's really the key to getting high quality care. The only way to know whether or not you're a candidate for reconstruction or for modifying your reconstruction is to get in front of a board certified plastic surgeon.
And they're the best, I'm telling you, and you're celebrating Thrivers every single day. One of the ways being the Pink Runway event that is happening again this October. It's October 23rd. It has been an honor to be part of this runway now for several years. I'm excited to be back with you all, and it's just so amazing what you do to make sure that women not only feel their best right after surgery, but to continue supporting them through their journey. I mean, it's amazing.
Thank you very much. I'm very much looking forward to that this year, and it is really an opportunity to give our survivors the opportunity to feel beautiful, powerful, and really get to display their true self.
And they're fabulous. You have to come and visit us again. It'll be on October 23rd. Thank you so much for being here today.
Oh, that's my pleasure. Thank you, Natalie.